Well, good morning. This is Dr. Bhatti again on this Saturday morning weekend, and we have a session today on hair transplant recovery after hair transplant. But if you have any other questions about hair loss treatment for men and women, about hair transplant, you're free to ask. But I would prefer that initially people would ask questions regarding hair transplant recovery. By recovery, we mean how long it takes to heal after hair transplant. What are the ways that you can ensure optimal growth after hair transplant by taking due care? What are the signs you should be aware of that all is going well and that there are no complications? What are the activities you can resume after hair transplant? Activities of daily living, going to the gym, going to work, and various other activities, sports that you might have in mind, questions that you might want to ask. So these are the topics that we are going to cover in today's live session at 6. Follicle fix at 6 every day. So welcome to my channel, to Follicle Fix at 6, early morning live streaming from Darlingbird's clinic. Your daily dose of hair wisdom served fresh at sunrise. So I'm Dr. Tejinder Bhatti, a plastic surgeon dedicated exclusively to surgical hair restoration. Across my clinics in Chandigarh, Mumbai, and Amritsar. And each morning at 6 o'clock, I meet you here not as a salesman, not as a salesman of hope, but as a custodian of truth in a world flooded with follicular fantasies and half-baked promises. So this live stream is where science meets sincerity. Here on a daily basis at 6 in the morning, we decode myths, clarify doubts, and lay bare the realities of hair loss, treatment options, and surgical advances without any jargon, without any gimmicks, without any personal motive. Because in this age of influencers and algorithms, truth is the rare serum you can apply to your scalp. So whether you're considering finasteride, wondering if PRP is worth the pinch, or simply looking for reassurance from someone who doesn't profit off your confusion, you've come to the right place. And let me assure you, your trust in me as far as hair loss treatment and hair transfer is concerned will not be belied. Think of this early morning session as your morning walk to the garden of follicular fact, not fiction. And in today's episode, we deal with hair transplant recovery. Not that I'm not going to answer questions that you might randomly ask, I will do that as well. But the basic theme of this talk is hair transplant recovery. And I would prefer that people come out with questions about the recovery phase of hair transplant till such time the hair grow on their scalp. Because what happens after surgery is as important if we have to achieve an optimal result, a result of a full head of hair, as much as the operation phase or the preparatory phase is for a hair transplant. So grab your coffee and let us demystify recovery like never before. So Mr. Boom wants to know, my hair gets very greasy after taking finasteride. Does this mean it's not working? As I read somewhere that high DHT produces more sebum. See, high DHT does not produce more sebum. What happens is when you take finasteride, your testosterone level starts to peak because a lot of this testosterone is not being converted to DHT. So this testosterone level piles up. And when this testosterone level piles up, it affects, it acts, it it puts in place the effect of androgens on various appendages of the skin, like sebaceous glands, And yes, oiliness can be there. You can have more oiliness, more greasy. It can be there. So yes, more testosterone can cause greasiness of the scalp, but you can maintain proper hygiene, wash your head in the morning as well as in the evening, and that should not be a problem. But this is a problem. Increased testosterone also enhances people who are young. It increases the acne formation. If you're prone to acne, it can cause acne formation. So this, I hope it answers your question. If you have any further question about recovery, or I will check out these questions that have been asked to me in the last few days about recovery. Now, the first question, I will just, from my question bank, I will answer these questions which have already been asked. And when I have questions from you, I will answer them one by one. So the first question I'm going to discuss is, after the hair transplant has been done, what is the earliest I can fly off to my country? See, the only things that restrict you from flying out are, number one, that there should not be excessive swelling of your face, because if there is excessive swelling and your face is not recognizable or you look sick, the airport is not going to allow you to board the aircraft. In my clinic, because of the instruments that we use, which are very less traumatic, swelling does not happen in my clinic. So patients travel back home to destinations as far away as North America, Canada, USA, UK, and Australia, New Zealand within 36 hours of the procedure. Most of my patients who come from abroad stay one night before the procedure and 2 nights after the procedure, after which they are all set to go back. They can travel long distances without any problem. But if you want that you need to stay here for a longer period of time, if you have taken a week or a 2 weeks break, you're most welcome to stay back and come back to us for review. Most people do not have this time. It is very safe to travel out after 36 hours. But if you're staying back in India, let us know. We will arrange your stay in our during the recovery phase in our villa in the Himalayas in Kasauli, where most of the patients who stay in the long term go after their hair transplant for recovery after the first 36 hours are over. The second question I've been asked is, how does air travel impact the healing process after hair transplant? Well, there is not much impact because the cabins are pressurized. There is no problem. Otherwise, it can slightly increase the edema, the swelling. So there are certain precautions you need to take while traveling abroad. One is lean back. Do not sit with your head bent forwards, because if you do, then because of gravity, that swelling can come between your eyes and the eyes may become swollen by the time you reach your destination in Canada or USA. Another thing that you should take care of while flying is that you should take the certificate from the doctor that your procedure has been done and show it at immigration. Also, you should embark into the aircraft. Either you should be the first person or the last person to embark. This minimizes trauma and it ensures your safety. Since your hair transplant has just recently taken place, we don't want any luggage falling from the cabin baggage, from the cabins above on your head, or you're being involved in a rush like situation, and your cap coming off and you dislodging some grafts. That's not what we want you to experience. Also, take the window seat. Aisle seats are dangerous because people walking past, their elbow might hit your head, or some luggage might inadvertently, accidentally fall on your head. So take the window seat. Also, when you reach the destination, the last airport, disembark last, and this saves you from the risk, whatever little risk there is, of getting hit inadvertently by mistake by a passenger unknowingly hits his elbow on your head, because there's a lot of rush when you get down, especially at Indian airports. How does air travel impact the healing? There's no impact of the air travel on healing, not at all, not whatsoever. And we have given you certain medications which you should continue to take during your journey. What precautions should you take during travel to protect transplanted area? I already covered that. Do not bend forwards. Embark be the first person to embark, show your medical certificate, and the last person to get down from the aircraft after you've reached a destination. And keep taking your medications. Is it safe to resume daily activities immediately upon returning home? Yes, you can. There are a few precautions that you need to take. Do not bend forwards for sustained period of time for the first 3 days after the hair transplant. Do not engage in physical activities um, like going to the gym for the first 1 week. Do not do rigorous weight training for 2 weeks. Do not bend forwards, and by bending forwards in your workplace, it means that you should not work on the laptop for 3 days. You should have a desktop, and a desktop in which you look straight ahead. You don't have to bend forwards. So then you are fit to join work the very next day after you reach your destination. Keep in touch with the clinic, prevent swelling from happening by bending forwards, and maintain the posture of the first 5 days while sleeping at night, as we have told you, 60 degrees leaning back in the first 24 hours, and put your head on two pillows looking up, straight up, after that for 5 days. So these were the some questions, and if there's any question, let me see if there's any question from you all. Yeah, the next question is, how should patients manage post-operative care without direct access to the surgical clinic? See, this is not a big time surgery. It's a long surgery, very laboriously done, very fine surgery. But this is not like opening your abdomen, opening your stomach for a gallbladder operation or your chest for a heart surgery. The downtime after hair transplant is very little, especially after FUE hair transplant. And if your procedure has been done properly in a clinic which is clean, which maintains its sterility properly, a doctor who's experienced, a plastic surgeon, or even a dermatologist who knows uh, the basic tenets of surgical practice, there is nothing to worry. I have not seen any infection happening in the clinic. Very rarely, extremely rarely. I've done about over 18,000 cases of hair transplant surgery. It is very rare for infection to happen or any complication to happen after hair transplant. We will be explaining you to the self-care that you need to do morning and evening, and that is pretty simple. But if you have any confusion, any doubt in your mind during that care period, you can always get back to us, and we'll take you on video and explain to you what you are doing wrong and what changes you need to do in your post-operative protocol, in your post-operative regimen that you're following, and also guide you from time to time online. We do it all the time. So there is no problem at all. Just understand the post-operative instructions properly before you leave India. Carry all the um, medical supplies that we'll be giving you in a kit. Do not miss it. Carry this in your check-in baggage. Do not carry it in the cabin baggage, because in cabin baggage fluids are not allowed. If they are allowed, there are minuscule amount is allowed, say about 60 ml, 100 ml, 60 ml, 50 ml. So in that bottle, you only carry the spray that you'll be taking, saline spray, which every 2 hours you'll spray, keep your grafts moist. Nothing else you should carry besides your medication. Everything else should be checked in to prevent losing your kit in the process. So what signs of complications should prompt immediate medical attention upon returning home? This is extremely rare, and even if it happens, it's very manageable online. Excessive swelling can take place if you've not followed your doctor's advice properly. There could be persistent pain for which some medication can be changed. Infection is extremely rare, but if it happens, it is easily manageable. If you have fever or any other infections, get in touch with us. This is extremely rare, as I keep telling you, but if it happens, you are free to get in touch with us, and we will not uh, give you any excuse that we are not picking up your phone or not taking your matter seriously. Are there any specific dietary recommendations to support healing after hair transplant? Well, most of the patients who come for a hair transplant are healthy people. You do not have to make any modifications in on your existing diet. Keep taking diet which is rich in proteins and vitamins and minerals, and you are on your way to hair growth. But a word of caution about something that people take very frequently and which is not good, not recommended for your hair health, especially after hair transplant, and that is whey protein and other supplements, but especially whey protein. It is deleterious to the follicles. It increases the susceptibility of follicles which are already prone to DHT, and it thins out your follicles and makes your result look weak. Also, avoid smoking in the first 1 week after hair transplant, because this can impair your circulation and it can delay recovery after hair transplant. So these things like smoking and vaping are not good for recovery after hair transplant. How can patients ensure the longevity and success of the transplant after returning abroad? Yes, stay in touch with us, follow medications. After 6 months, review your medications with me, and I will guide you accordingly. If you're young, you will have to take medications slow intermittently for a longer period of time. But if you're 40, 45, 50, we can, after 6 months to 12 months, we can taper off your medication, and you need not be on medication because more or less at this age, the baldness has stabilized. What measures can be taken to minimize scarring and promote optimal hair growth? Well, scarring is a process that happens at the time of the procedure, and there is no way that you can then modify these factors after the recovery. If a hair transplant is done with bad recovery, with bad technique, scars will form, and then it is not in your hands to correct them. They can obviously be camouflaged later by an expert who does hair transplant revisions and corrections, but there is very little that you can do about scarring. If you're talking about crusting, yes, crusting will come off in 2 weeks' time with diligent care, diligent post-operative care, as we tell you about the pink shampoo at our clinic, which is miraculous in removing the crusts and decreasing the chances of infection, and it causes early recovery. It is also advisable to avoid hairstyling products and heat treatments during the recovery phase. And then, is it necessary to inform local healthcare providers about recent hair transplant? Well, hair transplant is not a procedure which is a big time procedure as far as health is concerned. It is very rare to experience any side effects. And since it's a cosmetic procedure, even if you inform your healthcare authorities, your insurance provider, there's nothing much that they can compensate for if the infection happens, and even the compensation will be very paltry amount, because even if you need to buy an antibiotic, it's not going to cost you more than $20 or $30. So I don't think you should get into this rigmarole of informing your local healthcare providers like you do in other big time operations like heart surgery and abdominal surgery and weight reduction surgery. No, you don't have to inform local authorities. If you do, unnecessarily you're ending up in complications, and your insurance might next time they do your insurance, they might hike up the charges. Please do not do that. I will not advise you. Next question is, should you take a visa, a medical visa, while traveling to India? Yes, medical visa is required for traveling to India for procedures, but sometimes patients are just coming here for tourism and they decide on getting a hair transplant done, and there is no time left for them to take a medical visa. So I don't think it's a small procedure that you need a medical visa when you're in India for tourism. But if you're traveling specifically for hair transplant, yes, please apply for the medical visa and follow government rules and regulations. So the next question that we're going to cover is right now, at what time after the procedure should I get in touch with the clinic on a regular basis? You can get in touch anytime when you have a doubt, but if you don't have doubts, you're all set, everything is clear to you as far as treatment is concerned after the hair transplant. But there are certain timelines in which you should get in touch with us. The first is after 1 week, 2 weeks, then 4 weeks, 6 weeks, 3 months, 12 months, 3 months, 6 months, 9 months, 12 months. These are written in stone. You should not miss out on these dates. You should not miss out on these appointments with the clinic. Send your pictures so that we can reassure you that all is well, and we can also check out on the medications that you're taking. So it is very essential after hair transplant to be in touch with us at Darling Buds Clinic as per the dates provided to you in the discharge slip. Please do not mess up with that, because then if something happens, it's very difficult to rectify it if you inform us, say, after 1 month. So please inform us, give us updates from time to time as per this timeline that I've already told you about. When can I wear a hat after hair transplant procedure? Well, a hat after hair transplant procedure can be worn after the grafts are more or less stable, especially when you have got the temple points done. Because when you wear a hat, most of the hats impinge or rest upon the temple points, because this is the bulge here. And since the grafts have been placed here, we do not want shearing effect or friction to affect the healing of those grafts. So till 5 days in my practice, in my protocol at Darling Buds Clinic, we give you a soft cotton bandana which you wear while going out. Indoors, you don't have to wear anything. When you go out, you wear a black colored soft cotton bandana for 5 days. After 5 days, you can wear a hat with a wide brim, a flat visor which doesn't curl over your temples. And if you search on the internet, on Amazon, it comes under the name of a trucker's cap, like in a truck. So this trucker's cap visor is flat. It lifts up on or lifts off on the sides over your temples, and the temples don't get rubbed, don't get sheared by the very weight of your headgear. So after 5 days, wear a hat. If you're a lady, you can wear a scarf or a hat as you may deem fit. Many ladies also wear bangs over the front to cover the planted area, because in them the planted area is a little small, they can easily disguise it. But in men, no. When can I engage in gym activities? Well, you can go to the gymnasium after 7 days. After 7 days, you can do cardio exercises. But after 2 weeks, you can do weight training. Strenuous weight training can be done after 2 weeks. Sports, contact sports, please do not engage in contact sports for 6 weeks. You can go out in the sun after 3 weeks. Do not swim after till 3 weeks are over. And going to the beach, I will not advise till 6 weeks are over, because your scalp is very sensitive, and when you go out, your chances of getting a bad skin burn are much higher. So restrain yourself, refrain from going to the beach for 6 weeks. Yes, you can go to a beach resort. I'm talking about only going out in the sun, going surfing. But you can remain indoors at the beach, no problem. Many patients from my clinic who come to me from other cities or from abroad go to Goa to recuperate during the cooler season, and during the warm season like today, like we are in May and until June, July, August, they go to my villa in the hills in Himalayas, which is just 1.5 hours away. We have a whole setup of people to take care of you out there, and most patients who come from abroad who have taken leave and who want to be in India for some time for recovery's sake, stay there for a week or 10 days. So these are the questions. If there's any other question you want me to answer, please let me know. Yeah, next question is, when do I start the medication, finasteride and minoxidil? Well, since you'll be in your kit, you'll be given medication after hair transplant for the recovery, for like antibiotics, analgesics, anti-inflammatory drugs. They get over in 5 days' time. After these drugs are over, because all the drugs get metabolized in the liver, after these drugs are over, after 5 days, you can start yourself on finasteride. But as far as minoxidil is concerned, if you have been advised topical minoxidil, minoxidil lotion, minoxidil spray, minoxidil foam, and the crusts are not yet off, please do not use minoxidil till such time these crusts are off. These crusts will be off 2 weeks after the hair transplant. But if you're taking oral minoxidil, you can start taking oral minoxidil along with finasteride 5 days after your procedure. Once the crusts are off, get in touch with us. We will let you know whether your scalp is clean and what other precautions you need to take. So I have itching after hair transplant. What do I do? See, if your itching is before 2 weeks, before the crusts have come off, spraying with the spray solution kept in the fridge at 2 degrees temperature, cold saline spray will cause a lot of relief if there is itching. Just spray it over your planted area and the itching will be gone in a jiffy. But if itching happens after, if it persists after 2 weeks, you can take an antihistaminic, which we will advise you. And if there is dandruff, increased sebum formation leading to scaling, let us know. We'll check your scalp, advise you treatment accordingly. So we have a question here by a person who calls himself as My Story on YouTube. I have been taking finasteride under your guidance every alternate day for 4 months. I have good results, but I'm seeing side effects, reduced erection and low libido. Should I stop medication? See, you've been taking it for 4 months. I will advise you that if the symptoms are not too bad, take it for another 6 months, let your hair grow to their full potential, and then start taking breaks. Once you take breaks of 2 weeks every 3 months, there are very little chances of you having side effects, sexual side effects with finasteride. And the very fact that I have advised you finasteride means that I have also checked your hormonal levels, your testosterone levels, and your estrogen level, and checked your BMI, which must be normal to start finasteride. So do not lose hope. Please stick to this medication, and then all will be well after you start these breaks. So all will be fine. Don't worry. If there's any other question, please ask me. It's now been half an hour since we started. And if there's no other question, we can sign off and meet tomorrow for another live session. So since there's no other question, I will sign off. If you haven't subscribed, you're watching this, please, my fervent plea to you, please subscribe to my channel so I can be encouraged. I have the encouragement to bring more and more live sessions to you, more topics that are of help to you, topics that are without any motive, purely scientific topics and research-based topics which will help you in doing your hair transplant research wherever you might want to get your hair transplant done. That's not an issue at all. Mr. Travis comes just now. How long should I wait to get my scalp covered with hair for the first time? 4 months? Are you talking about hair transplant, or are you talking about hair loss treatment with finasteride? Mr. Trav? If it is hair transplant, then it takes about 6 to 9 months. If you're taking finasteride or medical treatment for hair loss, then the result that you will get will be one full hair cycle, 4 to 6 months. So thank you for watching. Have a nice day, and we'll meet you tomorrow.